One of the hottest topics, and has been for many years, is fat grafting. What do you think, Adam? Do you think fat grafting is worthwhile, not worthwhile? What are your feelings?
I think it definitely has a role. There's more and more people asking for it, but I find that I'm a little bit more conservative. Some of it is about the expectations, and what I found is that showing them what they're going to look like with fat grafting and showing them what they're going to look like with a breast implant. A third will go and say, yes, I like it, I'll go with it. A third will say, no, listen, I really want breast implants. And I have a few that say, listen, I don't want it at all, thank you very much, and I'm okay with that. But you do have some improvement, and if that's what they're looking for, then you could give it to them.
I think that you do have to manage patient expectations, but the thing that I hate the most in my office is a disappointed patient. And reliably, that's what I'm going to get with fat grafting.
I feel like the two of you have kind of limited the discussion to fat grafting for breast augmentation. How about fat grafting to the face?
Oh, sure. We're talking, that's a totally different story. That's much smaller volumes. That's much more precise. That involves preparation of the fat. It's not like wholesale transfer of fat to an area like the buttocks is, or to a lesser degree the breast is. But in terms of making a breast bigger, I think there are just much better ways to do it than fat.
Do you think that our technique has improved over time? Are we doing something now that makes fat grafting better than it was 20 years ago?
Yes, all the above. First of all, our techniques have improved. Two is that we found that different areas we have to use different techniques. In terms of the expectations, I think that's very important, but you could set expectations now. We have the technology for that as well. With three-dimensional imaging, I could show a patient, this is what you're going to look like with fat grafting to a close degree, and this is what you're going to look like with 300cc implant. So even expectations could be set now where, 5-10 years ago, it wasn't as easy.
Fat grafting to the breast as a concept has been around for, I don't know, at least 3 decades, and it hasn't really caught on. Why not? Because it's not a great thing.
I do feel like it's fair to point out when it comes to technique that I do believe that we have gotten better at our fat grafting techniques. I think that we'll leave with saying, in general, fat grafting is here to stay and a good procedure.
I would agree with that as a general statement, yes. Just not for the breasts.
Not for the breast.